All right.
Right this moment, there is a mad rush
Nope,
in America.
no more.
Apple, Amazon, Facebook, dozens more. They're all betting.
Stop. Good evening, ladies and gentlemen. My name, as usual, is Dr. Akano, President and Founder of Mr. Timothy Akano Foundation. Yeah, today is a historic day, isn't it? We've been watching what's happening in America. To God be the glory. For me, I'm not an American, but I'm happy that Trump is going. He's so un-American as far as I'm concerned. Anyway, that's by the way. So today, we shall continue with our series on breast cancer. Exactly a week ago, we talked about this breast cancer, but we talked about it in men, which is the insignificant part of it. So today we're going to be talking about breast cancer in women, and this is the main breast cancer really, because 99% of all breast cancers are in women. So that is why it is very, very important. So I shall be talking about it. It is not very much different from that of men. The difference is that because men just have tiny breast tissue around their nipple, so their chances of having breast cancer is less. Unlike women, that everywhere in their breast is breast tissues and ducts and everything. So, all right. So obviously we know what breast is. Women have two breasts. And obviously, they do have cancer of the breast, like other parts of the body. So I'd like to say that breast cancer is the commonest cancer in women. Number one cancer in women. And in fact, breast cancer and lung cancer are the most common cancers generally. So you can see, statistically, 1 out of every 8 women will have breast cancer in their lifetime. So up to 12.5 to 13% of all women would have breast cancer. And 25% of all cancers women have is in their breasts. 25%, a quarter of all cancers the women would have, it would be the breast cancer. So it's quite common and it's very significant. Breast cancer is commoner in the developed world than in our world, the developing, and it's commoner also in elderly women. When I mean elderly women, usually women from 50 and above. And that does not mean that younger women don't suffer from breast cancer. They do suffer from breast cancer, but it's commoner in women of 50 and above. Between 50 and 70, 74, your chances of developing breast cancer is highest. So that is a little bit that you need to know about breast cancer in terms of epidemiology. So it's commoner in the elderly women, obviously commoner in the developing world. It is very common. Up to 12.5% of all women who have breast cancer in their lifetime. So it is quite common. 25% of all cancers any woman would have would be breast cancer. So what are the causes of breast cancer? Like in the men, there is no clear cause of breast cancer. There is no clear cause. But we have what we call risk factors. Risk. These are situations, both environmental or genetic or dietary, whatever, that put you or put the patient at risk of developing cancer. So there is no one risk factor that one can say, puts you at risk, but the combination of them could put you at risk. There are several risk factors, and I'm going to endeavor to list some of them. Some of them are modifiable, which means, there are things you can help while some of them are things you cannot help. You just have the risk, you have the risk. So what are the risk factors? What are the things that put you at risk to developing breast cancer? Number one is age. The older the woman gets, the higher the risk of developing breast cancer. Age. So you can't help that. You must age. So by the time you start getting to 40, 50, 60, your risk is higher. Obviously, sex is commoner in women than in men. Almost 90 to 99% of all breast cancers are in women. Again, obesity. If you're very fat, if you're obese, obesity in obese people, estrogen level is high. So if you're obese, your risk of developing breast cancer is high. If you didn't have children of this, oh my God, I don't want this tonight. So what I was saying, if you didn't have children at all, or you had children at an adult age, your risk of developing breast cancer is high. If you didn't breastfeed your child, after having a baby, your risk of having breast cancer is high. If you have very large, dense breasts, your risk of developing breast cancer is high. If you have early menarche, means if you started seeing your period very early, less than 12 years, your risk is higher. If you stop seeing your period, menopause, later than 52 years, your risk is higher. If you smoke, your risk is higher. If you drink a lot of alcohol, your risk is higher. If you don't do exercise, your risk is higher. If you have had radiation to your chest before, maybe from x-rays or previous treatments of radiation to your chest, your risk is higher. If you take medication which we refer to as hormone replacement therapy, HRT, which women in menopause take to stop them from having menopausal symptoms, if you take it for up to a year, your risk is higher. If you take some contraceptives, which we call combined oral contraceptive pills, you have a slightly higher risk. So you can see, and then obviously we have family history. If you have a family history of breast cancer or ovarian cancer, your risk is high. If you have had the cancer before of the breast that has been treated and cured, your risk of developing it again is higher. If you also have a lump, there's this kind of lump in the breast that is not actually cancer, it's a kind of hyperplasia, ductal hyperplasia. If you do have that, your risk of developing breast cancer is high. So there are several risk factors. So if you have a combination of that, of these risk factors, then there is this genetic chain you can inherit from your mother or from your father. It's called BRCA or BRCB, BRC1 and BRC2. If you followed Angelina Jolie when she did the breast operations, you would know about it. So if you do inherit that, you can inherit it from your parents. You are at a high risk of developing breast cancer. So there are several risk factors which I have been able to list. Then, what are the prevention of breast cancer? Breast cancer is a cancer that can be prevented. Number one, obviously, if you do go for your screening, and if you do screening, that can help you. But the preventions include things like losing weight, that will reduce your risk. Breastfeeding, that will reduce your risk. If it's possible, have your children early, that will reduce your risk. Eating healthily will reduce your risk. Doing exercises will reduce your risk. Not smoking and not drinking excessively will reduce your risk. There is yet another dramatic prevention of breast cancer, very dramatic. So if your risk is very high, maybe because you have this genetic problem that I mentioned, and you haven't reached menopause, you can undergo treatment to stop you from developing breast cancer. So the treatment could range from removing your two breasts completely, like Angelina Jolie did. So if you have a high risk of developing breast cancer, you can go and have your breast removed and then probably have a reconstruction. Or you can have medical treatment, which is tablets. You can take tablets that reduce your body ability to produce those sex hormone, estrogen, progesterone, or to stop the activities. We'll have tamoxifen, especially when you're not up to menopause. And then you also have anastrozole and raloxifene. These medications, and each of them, you don't have to take 3 of them. The patient takes 1 tablet a day for up to 5 years to prevent you from developing cancer of the breast. This is if your risk has been assessed and it was found to be very high. So these are the ways you can prevent breast cancer. The next topic is, how do you screen? The essence of screening is to detect breast cancer when it is not possible for you to feel or see it. So when you detect it early, the chances of total cure or better outcome are better. So the earlier the diagnosis, the better for you. So that's why it's good to go for screening. Different countries have different screening programs. Like in the UK where I live, they screen women between 50 and 70 years and then bring them back after 3 years. Some countries like Canada will do, I think, from 50 to 70 or whatever and bring them back after 2 years. Different countries, but usually 45, 50 to 70, they screen and then you come back after 2 years or 3 years to do it again. What are the screening procedures that they have available? Number 1 is mammogram. Mammogram is a kind of X-ray that is done to detect, lumps and abnormalities that you can't normally feel by yourself. So that is the essence of mammogram. Then, in women with very dense breasts, mammogram is not usually very effective. So the screening we normally recommend for such people are ultrasound scan. Ultrasound scan is the same kind of scan that they do on pregnant women. But obviously this is now your breast that is being scanned. And you can also have MRI scan of your breast. These are all screening procedures. So the screening is important. When you have started, your clock is clicking and you're like 40-something years, you should go for mammogram. If you have very big breasts, because the radiation will not pass through in mammogram, so you go for ultrasound of your breast to detect lumps or abnormalities that you can't normally see or feel. So screening is very crucial. It is important. So if you're of that age, I would advise you to go for screening. Screening is available in Nigeria, so it's not rocket science. So I will quickly talk about types of breast cancer quickly and then move on. The commonest type of breast cancer is the one we call invasive breast cancer. It's invasive. It has gone out of the ducts into the breast tissues. Obviously, we have the non-invasive one that is still localized within the duct. Then you have the inflammatory one, you have the lobular one, you also have the Paget disease, like in the men as well. So these are the types of breast cancer. There are several, even up to 17, 18 subtypes, but I won't belabor you with that. But most of the breast cancer in women are the invasive type that have left the dust into the surrounding breast tissue. So these are it. So the next thing we're going to talk about would be, what are the symptoms? What are the symptoms of breast cancer? The symptoms of breast cancer, number one, the most common symptom is breast lump or lump anywhere in the breast or your upper chest or in your axilla, that's your armpit, lump. I have to emphasize that not every lump in the breast is cancer. To be exact, 80% of all breast lumps are not cancer. It's about 20% that are cancer. 80% would be maybe benign lumps, what we call fibroadenoma, or maybe you have cysts, fat, necrosis, and all that. But about only 20% of breast lump is cancer. So breast lump is number one symptom. Number two symptom of breast lump is if you have a rash or a sore around your nipple or that area that is not healing, or your nipple that normally is everted, that is protruding out, suddenly starts sucking in, going in, or one breast becomes bigger than the other, or you start having change in color, maybe your breast starts becoming red, or the skin of your breast starts dimpling, like the way you have dimple and your breast starts dimpling. Or if you do have discharge from your nipple, whatever discharge, I'm not talking about breast milk when you're breastfeeding, maybe blood or any discharge from your breast. Or any change of form of your breast. If your breast, and then like I mentioned last week, there's something we call mastodynia, pain in the breast. It's not usually a symptom of breast cancer, but if you do have breast pain that is unabating, that is there all the time, then you should worry. It may be a symptom of breast cancer. So let me reiterate: breast lump, eversion, or the nipple, eversion of the nipple means the nipple instead of protruding forward is now going back into your breast. Rash, sore, nipple discharge, change in color, change in form, change in size of your nipple, any lump that's in your armpit, upper chest, or anywhere in your breast. These are some of the symptoms of breast lump, which includes, I said, like dimpling of your breast, the skin. You see those small dimples on the breast. These are all symptoms of breast cancer. It's not just lump. And like I said before, it's not all lumps that are breast cancer. 20% only. 80% of them are benign, means they're not cancerous. However, it is important to emphasize that every breast lump, need to be looked at. They need to be looked at because you haven't got a way of knowing that this lump is not a cancer unless it's looked at. All right? So these are the symptoms of breast cancer when the cancer is still localized within the breast. But if the breast cancer was not diagnosed on time, it may metastasize, means spreading to other parts of the body, which includes maybe brain, your lungs, your liver, your bones. So you may have symptoms based on the fact that they've gone to other parts. Maybe if it's in your lungs, you may be having cough, you may be having shortness of breath. If it's in your liver, you may be itching, you may have jaundice, you may have bone pain, weight loss, headaches. So it depends on where it is. So there's something before I forget it, because it's possible that I can forget it. When I talked about types of cancer. There's a variant of cancer, breast cancer, that you just need to know about, which is called, okay, maybe I should talk about it in treatment. I will talk about it when it comes to treatment. I won't forget. So the next thing, we've talked about cause, symptoms and all that. So we'll talk about now, how do you diagnose breast cancer? How do you diagnose breast cancer? First and foremost, the first thing to do normally as a woman is what we call self-examination. Self-examination means you have to be examining your breast yourself. By what we know, there's something we call TLC, TLC of tender loving care. TLC is touch, look, and check. So you, by yourself, use your fingers, feel your breast around, feel all around. Check your armpit, check your upper chest for any lump, and also thickening of your breast. That's another symptom of breast cancer that I forgot. If your breast thickens, so you check, then you press your nipple for discharge, and just look and see whether your nipple is protruding or whether you've got rash, all that. So self-examination. It is important that every woman examines her breast, from time to time, to see whether there are abnormal lumps, to see whether the rashes, or whether there are changes, dimpling, puckering, discharges, rashes, or whether one breast has become bigger than the other, or whether there's changes in color, or changes in the form of your breast, or any abnormality there. So it's important, self-examination. Obviously, then apart from that, you would, I've talked about mammogram, which you use for screening. You can also use this for diagnosis. Mammogram will give you diagnose cancer that you can't feel with your hand. The very tiny ones that you might not be able to feel, mammogram will feel it. Ultrasound. But the mainstay in the diagnosis of breast cancer, and indeed a lot of cancer, is biopsy. So biopsy is that process where you take part of the lump or the tissue and then take to the lab for analysis to see whether there are cancer cells. So with breasts, there's something we call fine needle aspiration. The doctor will put a needle through your breast into the suspicious tissue, aspirate little fluid, and then take to the lab. Sometimes they do what we call core biopsy. Sometimes they remove the whole lump, excisional biopsy. But that is the main diagnostic tool, biopsy. So, after the diagnosis, the cancer will need to be staged. The stage gives an idea of how far the breast is gone. So you may have to undergo some more investigations like MRI scan, bone scan, and all that, in addition to the investigations you've done already. So this is how to diagnose breast cancer. It's simple. It's not very complicated. So the next thing to talk about is, how do you treat breast cancer?
Oh, sorry.
I'm busy. Chidera. So how do you treat breast cancer? If you're diagnosed with breast cancer, you may need to undergo some tests to determine the kind of breast cancer you have, so that it can be determined the kind of treatment you could have. Because the kind of treatment you have depends on the type of breast cancer, your age, and how bad it's gone. So that brings me to what I wanted to talk about, which is called triple negative breast cancer. Triple means 3, negative breast cancer. So normally, the breast cancer is fueled by female sex hormone, estrogen, and progesterone, normally. So if you have a lot of it, it is expected, or it is believed, that your breast cancer will grow quicker. So in the triple negative breast cancer, it is, after the test, it is shown that your breast cancer is estrogen receptor negative, progesterone receptive negative, and has excess His protein. So what it means is that your cancer does not respond to, it is not responding to estrogen or hormones. So hormones do not contribute to this, your cancer. So what it means is that when I'm talking about treatment, you understand better. So what it means is that if you have this triple negative kind of breast cancer, hormonal treatment will not work because it does not respond to hormones. So this is the type of cancer that is very invasive and very aggressive. It goes very quickly. It can kill quickly. However, it has treatment. And this type of cancer, you must undergo both surgery, radio, and chemotherapy. So that's triple negative. While the hormone positive ones can respond to hormone treatment, which I'm going to talk about. So that's triple negative. It's a very aggressive breast cancer that some women do have that medication will not help. So you will need to take very serious treatment to, but it's very aggressive. It metastasizes very quickly. Metastasis means spread to other parts of the body. Because with cancer, you have what we call primary. Like I said last week, primary is where the cancer started from, and then secondary is where it is spread. So you might be maybe doing a scan, somebody will see that the person has cancer of the liver, but that's not where it started. It probably started from the breast, and he has spread to the lungs. So what are the treatments available for cancer of the breast? Number one is surgery, operation, which is the main treatment. So we have different kinds of treatments, operation that you can do. You have obviously mastectomy, which is removal of the breast. Mastectomy is removal of the breast. But these days they do what we call breast conserving surgery. They can do that. It all depends on how bad your cancer it is. Breast conserving surgery means they're not going to remove all your breast. So you may undergo what we call lumpectomy. Means they will remove the lump and the normal tissues around the cancer. And that's what they will take out. And evidence shows that when you do that and have radiotherapy, the outcome is as good as when they removed your breast. So there's one called contractectomy, means they take up 1/4 of your breast. Also, so instead of removing the whole of the breast, because we have what we call radical mastectomy, they remove your breast, remove all the lymph glands, and then peel, including your armpit. So that's mastectomy. So if you do have mastectomy, you can also have reconstructive surgery. It is available where the plastic surgeons will help you construct something that looks like breast for your own psyche, for your own what's that word now? For you to not to be depressed now. What was the word? I remember I tell you, but you can have that reconstructive surgery. So the treatment modalities surgery. So it's either they're removing your breast or they're conserving your breast and removing the cancer tissues. Do wide excision. Remove the lump or do contractectomy and all that. And then obviously you have radiotherapy, which is treating of the cancer cells with radiation. You have chemotherapy, which is using cytotoxic things that kill cell, treatments, medication, and like injections to kill the cancer. Then you have what we call hormonal treatment. So this hormonal treatment will not work on the triple negative cancer. This hormonal treatment is medication to either reduce the level of all the sex hormones, as in estrogen, progesterone in your system, or reduce their activity. So, which I mentioned before, things like tamoxifen, raloxifene, and anastrozole. So, and there's another treatment they call targeted therapy. But most people will have the surgery and then have either chemo or radiotherapy on top of the surgery. Or if it's triple negative, you will need to have both surgery, radiotherapy, and chemotherapy. So these are the treatment. Then that also brings us to prognosis. So if you do have breast cancer, what happens? So as soon as your breast cancer is diagnosed, the cancer will be staged. The staging gives us idea of how far the breast cancer has spread, whether it's still contained in the duct, whether it's in the breast tissue, whether the lymphatic lymph glands are involved, or whether it has spread to the brain and all that. It is similar to what I talked about last week. TNM, T is tumor size, N is whether the lymph node is involved, and M is if it has spread, metastasized. So the stages from stage 0, where the cancer is still localized within the duct, to stage 1, where it is outside the duct and is less than 2 cm. There is no lymphatic involvement. There is no metastasis. Or stage 1, stage 2, where is about 2 to 5 cm, and there is no lymphatic involvement, and there's no metastasis. Then there is stage 3, where it's over 5 cm, and there may be lymphatic involvement. And stage 4 is the terrible one, where it has metastasized. That one, if it's stage 4, you need to have all the treatment, and even at that, prognosis is bad. And often you have what we call palliative treatment. Palliative treatment means treatment of your symptoms to keep you comfortable and prolong your life a little bit till you die. If you have that stage 4, it means the patient will die. It will die unless there's a miracle. So if you do have pain, we'll give you morphine injection. If you're vomiting, we'll give you anti-sickness medication. If you're agitated, we'll give you anti-anxiety medications and all that. So that is palliative care based on staging. And this staging gives you an idea of how long you're going to live. Like if you have stage 4, your chances of living up to 5 years after diagnosis, if it wasn't treated, would be 10%. But after treatment, your chances of reaching 5 years after diagnosis will be 20%. But the other stage, stage 0 and stage 1, if it's obviously diagnosed early, which it is, and you are treated, 5-year survival is up to 100%. While stage 2 and 3 could be in advanced world like UK, US, 80-90%. So this is the prognosis. So I didn't want to make it complex. I want to break it down. That's why I wanted to break it down, so that even a layman and African people, DCOG, would understand me. That's why I broke it like this. So in a nutshell, I have been able to describe and explain what breast cancer is, the types, causes, risk factors, prevention, how to diagnose, how to screen, how to treat, and also talked about the triple negative, and also talked about how to prevent by removing your breast like Angelina Jolie did, even when she didn't have the cancer at all. You have this mastectomy or take medication to stop you from developing the cancer at all. So, and I think I talked about how to prevent. So, I've covered the areas I want to cover. I know it's late. I think next time we'll start earlier. So I'm going to look and see questions to answer. So I don't know. Let me see any question here. Hello, people. Everybody seems to be quiet today. I hope I've not infected you with quietness today. Or is it Trump
On a radical new technology.
Trump supporters are crying? So I hope I was able to deliver this topic well without confusing anybody. Let me see. I just want to be a simple man like you. I know. It's good to be simple, isn't it? Yeah, somebody said they were not feeling too good. Blessings. I'm so happy. Chinaze Ekbere. Your name is nice. Nice music. So I can't, to be honest, I haven't seen any question at all. Is it the thread or what? The funny thing is that Honorable Prince Silas said, which one is common to men? I don't know what you mean. Oh, you mean cancer, lungs. Cancer of the lungs is the commonest in men. If your mirror banks, if your nipples always pain you, you know, it might be infection, it may be trauma, but if you do have pain in your breast that is all, you know, all the time, then you need to have it checked out, darling. You must have it checked out. Occasional pain there and there, you can have infection, what you call mastitis, especially when you're breastfeeding, you know, or when somebody has sucked it and made a little injury there and then it gets infected, you know. So, interesting. Edith, you tell me more, sir. What more do you want to hear? Yes, Fola, every breast lump needs to be looked at. Every. You know. Faith, Lordship, good evening. It's true, I didn't see you with your favor today. It's unusual. Ojukwa. Chinyere kedu, Alozie. You alright? How is the new baby? Yeah. Use your fingers to do what? Can it be inherited? Yes, Florence I said it. It can be inherited. You know, a mother can pass, a parent can pass the gene to the child. Yes, said so. Yes, Precious, TLC for self-examination. Yeah, Fola, yes. Breastfeeding has got no disadvantage at all. It is so good. It reduces your risk of cancer, as well as, obviously, saving you cost as well. And the baby, you know, the advantages, I don't want to go into them now. Dr. Ikbo, how you doing? Constant wearing of bra. There's no evidence that constant wearing of bra increases risk of developing cancer. If you want blessing, yes. Self-examination, mammogram, ultrasound, biopsy, bone scan, and all that. You did well. Yes, you are right. You know, I have lost what biopsy. I said biopsy is that procedure where either the tissue or part of it is taken out, maybe through aspiration, like use a needle and put in there and aspirate the liquid, or they use a knife, you know, not surgical knife, not the knife in your kitchen, and take part of the tissue, or all the lump will be removed and then taken to a lab, a pathology lab, not where you do blood tests, pathologist lab, where the pathologist will analyze the tissues and the whatever that was taken to see whether they have cancer cells in them. Can cancer be inherited? Yes, absolutely. It can be inherited. Thank you, Blessing. I mean, Nuella, some women, one breast is slightly bigger than the other, but if that is normal for you, that's fine. But if, you know, suddenly one of them, you know, starts becoming a lot bigger than the other, then you have to worry. Oba Joy, thank you. Thank you for the compliment. Faith, Lordship, thank you. Thank you too. Chidima, thank you. Yes, Ndu Ukamaka, triple negative cancer is very aggressive. and it doesn't respond to hormones. Yes, they're aggressive and doesn't respond to hormones at all. Yes, Joyce Oswala. Yes, if a woman is over 40 years, you should go and do mammogram. But if you have very big breasts, like what's that lady in Big Brother, or Dorothy, then you should go and do ultrasound of your breasts or MRI scan, because the mammogram may not show what you're looking for, because obviously the breast is so dense that the radiations don't really pass. Do you understand? Do you understand why a woman with dense breasts may not do mammogram? Who was asking me these questions? Some trauma is, what age do women experience breast cancer? If any woman can experience breast cancer, but it's commoner in women from 50 years and above, but any woman can suffer it. Mosu, Jesse, babe, so what happened when someone is having pain inside the breast, chest area? The person has done scan, nothing seen. Can it be caused by ulcer? Ulcer will not cause pain inside the breast. I don't know what you mean, breast, chest area. When someone is having pain inside the breast, chest area, okay, maybe. No. If you have chest pain, there are so many reasons you may have chest pain, so you may need to check it out. You may not need to do an X-ray. You may need to do an ECG, which we call echocardiogram, and then you may also need to do some exercise ECG or exercise tolerance test. To see whether it's angina, whether there are so many reasons why you can have long-term chest pain that is not related to the breast. So you may need to see your doctor, who may do the right test. Sometimes you may do a test we call echocardiogram to see, but just see your doctor, because I don't think that's breast cancer. Oh, freak shit. If you're just coming, I'm gonna obviously save this after this time, so that you can, because I can't keep going back and back, but I'm going to save it. So at your spare time, then you can listen to it, and
I thought to come on here today to not just invite you for a webinar, a workshop, information session, no call.
Oluchi, I didn't say it is a must that it will be inherited. I didn't say it's a must, but it can be inherited. It's not a must. Jesus, Omekanaya, I worship you today. Jesus, Omekanaya, I bow before my throne. Jesus, Omekanaya, I worship you today. Jesus, Omekanaya. Evelyn, oh, you slept off. Don't worry. I think next time I'll do it much earlier. nara 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 ekele m jiri bịa onye dị nsọ nara 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 ekele m jiri bịa onye dị nsọ onye dị nsọ I glorify God to you onye dị nsọ. they are recycling them. What is the cause of nipple pain? I mean, you can have nipple pain because you have cancer. You can have nipple pain because you have infection of the nipple. You can have nipple pain because you have injury to it. You can have nipple pain because you have what we call Paget disease of the nipple. You can, a lot of things. I don't know what is causing yours, but obviously, if you have nipple pain that is not going away, you need to have it checked out. You have to check it out. Clara, every woman is prone to having breast cancer, even though it's commoner in women from 50 years. 1 in 8 women, 1 out of 8 women will suffer breast cancer in their lifetime. So it is very common. So yeah. See my kids laughing at you. Sing more, Biko. See, what is good for the goose? I mean, they say beauty is in the eye of the beholder, whatever. Why some people say my voice is horrible? Some others say sing on is nice. I don't know, Mike, this question that Facebook is not delivering. Somebody asked me, can someone contact you through rough lifestyle? What exactly do you mean by rough lifestyle? What is that? Make it clearer. What is love? Well, I've already mentioned that excessive drinking, smoking, obesity, all put you at risk. I don't know what you mean by a rough lifestyle. Ada? I bet you can do it. Amanda, you're ready to go. That's a good news. I'm happy for her. If you had pain in your breast, I don't know how big your breast is. If your breast is big and mammogram didn't show anything, you have to do an ultrasound. Go for an ultrasound of the breast. At least somebody that knows how to do ultrasound will do it. But if your breast is not very big and mammogram didn't show something and you're still having pain, I think you should go to the breast clinic. Mike, is it hereditary? I'm surprised that Mike is asking this question. Right? Is it that you're not hearing me? Very important question. Evelyn Energia, can someone who suffered from ovarian cancer also suffer from breast cancer? Very good question. There's a genetic relationship between breast cancer and ovarian cancer. So if you inherit that BRC gene, you can suffer both. So yes, someone can suffer from ovarian cancer as well as breast cancer. Thank you. I hope I answered your question. I've answered the question about this nipple thing. I've answered the question, can it be hereditary? I've answered it many, many times. So I can continue answering it over and over. So faith lordship is well understood. I'm happy about that. You know. Mike, breast cancer are rare in men. Yes. 1% of breast cancer is happens in men, but they do have it. I talked about it last week. Yeah. Thank you, Genevieve. See, you're not a witch like Marco. My candidate won, so nothing concern me with Biden. He's not my candidate. I'm a Nigerian and I'm a British, so I'm more concerned about what happens in Nigeria and Britain. Even though Trump, no Jagodas, as far as I'm concerned, is not that kind of person doesn't deserve to be the president of a country like America. That's my own take. Yeah, Faustina, thank you. It was easy, isn't it? Mike, this one you're fighting with Facebook. I hope I've been able to answer some of your questions. Evelyn, I've answered your questions. I'm answering the questions. Joyce Oswala, you cannot contact breast cancer through food. Nope, at all. But eating unhealthily puts you at risk, but you cannot contract it through eating. It's not that. It's not gastroenteritis that you eat, or hepatitis A that you can, or typhoid that you can get through food. Breast cancer is not an infection. Daddy, call me, please. I hope it's not my own daddy. I'm not daddy anyway. It's not me that they're asking to. Joyce Oswala, one of my mom is always having boil on her armpit. Yeah, if she does have boil in her armpit or recurrently, so that is not breast cancer. I don't know whether she's diabetic, because if you're diabetic, you do have a lot of boil. If you have some skin problems, you can have boil all the time. So some people do have that, and they have antibiotics, and if antibiotics don't work, the boil is cut out, drained, and then cleaned out properly so that it doesn't recur. Joyce. So who else? Please, what of fluid if coming out from one breast? If I don't know, I mean, if you have if you're having discharge, this I'm talking to Joy Michael. If you have what we call hyperprolactinemia, I don't know how to go. If your prolactin level is very high, you can have discharge from your breasts, which looks like breast milk, which we refer to it as galacturia. So if you have that hyperprolactinemia, you can be discharging from your breasts. So that one, you need to see an endocrinologist, and they put you on medications like bromocriptine and things like that to reduce your prolactin level, and that will stop. And when that prolactin level is high, it could lead to infertility. You won't be able to take in. That's a different. I don't want to go into that long process now. Diamond, some people said breastfeeding falls the breast. I don't know. I mean, they have to make a choice between their risk to cancer and then, bringing forth a healthy child and then the cosmetic look of their breasts. Umea Koekwe, thank you. Noella, my sister. Oluchi Ochiaka. It is not a must. It is not a must. You can inherit it, but it's not a must. I've answered this question over and over. It is not a must. It is not a must. Jonathan, do you have a hospital in Nigeria? Nada. I don't live in Nigeria. But soon, I will have a hospital in Nigeria, but I don't at the moment. Even though in Port Harcourt, my family have a very good hospital called Ponis Hospital. So if you want, I can recommend that for you. Ugochi, thank you. That's why they give free lecture. Oh my God, you look for trouble a lot. Shulamite, you're asking her what she's doing here. No. Shulamite is free to be here, and nobody will ask you to come out. That's my brother. Me and him we don't talk, and we have understood ourselves, so no more issue. Eh? We are one and the same thing. Okay, say please don't stop the music. Is the music that you want to listen to, not my teaching? Okay, I'm not paying to play the music. think this person that's asking me about staphylococcus, whatever, maybe staphylococcus. Staphylococcus where? Which part of the body? So I think I shall call it a day. Thank you, ladies and gentlemen, for joining in as usual. Even though we didn't have as much as we had last week, I suspect maybe people are celebrating Biden's win, or because we are quite late in starting. So next time we'll probably start earlier. We'll just trying different times, you know, and see when is most suitable that more people would come on board. All right, guys. Thank you very, very much. Remain blessed.